Thank you for listening to Depictions Media Radio.
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is a COVID-19 briefing for British Columbia for Tuesday, February the 16th. We'll be providing written briefings tomorrow, Wednesday, and Thursday, and then we'll be providing an in-person briefing on Friday. On Thursday, in addition to the regular briefing on long-term care home and assisted living outbreaks, we'll be providing detailed information on the level of immunizations in care homes across British Columbia. That's on Thursday. And with that, it's my honor, recognizing that we're on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nation. It's my honor to introduce Dr. Bonnie Henry.
Thank you and good afternoon. So today being the Tuesday after a long weekend, we have 4 periods to report on today. Between Friday and Saturday, we had 452 new cases of COVID-19 diagnosed in British Columbia. From Saturday to Sunday, an additional 431 new cases. Between Sunday and Monday, 348 people were diagnosed with COVID-19. In the last 24 hours, we've had an additional 302 new cases. That is a total of 1,533 new cases diagnosed over the long weekend, 6 of whom were epidemiologically linked. And that brings our total number of people diagnosed with COVID-19 to 74,283 in British Columbia. Of the new cases, 392 are people who reside in the Vancouver Coastal Health region, 856 are people in Fraser Health region, 58 people reside on Vancouver Island, 92 are in the Interior Health region, and 135 people were diagnosed in the Northern Health region. We now have 4,189 active cases in all health authorities in British Columbia, of whom 231 people are in hospital, 74 of whom are in critical care or ICU. And an additional 7,136 people are under active public health monitoring, and 68,705 have now fully recovered. Over this past 4 days, we've had another 26 people across British Columbia who've died from COVID-19, bringing the total number of people to 1,314. As always, we know this is such a challenging and difficult time for families, for caregivers, and for communities to lose loved ones to this virus, and our condolences are with you, and our thoughts are with you today. We have 3 new healthcare outbreaks to report today at Eden Gardens, at Wexford Creek, and at Shaughnessy Care Centre. As well, we have 3 outbreaks that have been declared over at Heritage Square, at Concord by the Sea, and Holy Family Hospital. So we now have 15 active outbreaks in long-term care and assisted living, and 6 in acute care units, involving 561 residents and 349 staff. In the community, we've had an additional outbreak declared at Timothy Christian School in Chilliwack, and we've had an outbreak as well at SFU Childcare Society. And Fraser Health is involved with investigating and managing both of those. An update today on our variants of concern. To date, we've had a total of 60 people who've been infected with variants of concern. That's 40 of the B117 associated with the UK, 19 people who've been diagnosed with the B1351 variant that's originally associated with South Africa, and 1 person, as I mentioned last week, who has the B1 525 variant that's been first detected in Nigeria. And when we talked about it last week, it was one that was called a variant under investigation, as they were still discussing nationally and internationally whether there were some of the changes, the mutations that this variant had that might confer an advantage in terms of transmission. And as of today, it has been noted as a variant of concern because of some of the mutations that are involved. Since the start of our immunization program, we're now up to 171,755 doses of vaccine that have been administered in BC, and 22,914 of those are people who received a second dose as well. As we know, the past couple of weeks have been very limited in terms of supply, and we're really pleased to say that this week deliveries of the Pfizer-BioNTech vaccine are resuming. Some has arrived already, and more will be arriving in the coming days. There has been some short delays because of weather, both in the United States and across Canada, but this is encouraging. Our supply still remains somewhat limited, and we need to continue to build up our program as more supply comes in and we have more stability in the arrival of the vaccine over the coming couple of weeks and into March. We are focused really on providing the second doses, particularly to those people who are at highest risk, which are our residents and seniors in long-term care. I know that many people have had questions about what deferring the second dose for a period of time may mean for how well the vaccine works or vaccine effectiveness. And really, we've been following this, of course, very carefully in countries that started their immunization programs ahead of us, and looking at the data that's been collected from the UK, from Israel, and from here in Canada. And we have some early data from our long-term care homes here in British Columbia. We have some data that we've looked at over the weekend from Quebec, along with my colleagues. And there's evidence from the WHO and others, showing that this delay of several weeks between the priming dose of these vaccines and the second dose, which is a booster dose, does not have a negative impact on vaccine effectiveness. What this means is that as our body is building up antibodies and our immune response is building after the first dose, that is sustained for a period of weeks. It may, in fact, and we know this from other vaccine programs and from how our immune system works, result in the end in a stronger and more long-lasting protection. Vaccines stimulate our immune system in several ways, but there's two main parts to our immune system that are stimulated when we receive an immunization. First, the vaccine triggers what we call antibodies, and these antibodies are the things that bind to that protein on the outside of the virus, the spike protein, and prevent it from binding to our cells and getting into our body and being able to replicate. And that is what we see first. We see these antibodies increase over a period of days to weeks after we're immunized. It's one of the things that we can measure most easily, because we can measure what we call neutralizing antibodies, or the antibodies that actually affect that spike protein in the blood. And it's something that we know is a marker of how well we are protected from infection. But there's also a part of our immune system called the cellular immune system. So these are things that are cells that are in our blood, what are called B cells and T cells. And these are cells that live in our lymph node and in our blood system, and they take time to fully develop. And they also modify and they react to the things like the protein on the outside of the virus. And it's these cells that take longer to build up, but are longer lasting as well. The memory of these antigens in the T cells and B cells, our cell-mediated immunity, is what protects us over the long term. And we know from immunology, we know from other vaccine programs, that having a longer interval between your priming dose and your booster dose allows those cells to develop as well. and maybe the reason why we have a more longer-lasting benefit if we have a longer gap between the first and the second dose. It is still too early for us to know how long this initial immunity lasts in people, but we do know that the current vaccines are very effective, and the data from around the world shows us that this protection does last for many weeks. Here in BC, we've been monitoring residents of long-term care homes and have been connecting them to people who have developed COVID-19. And what we've seen is that in the 3 weeks after the initial vaccine in long-term care residents, the protective effect of the virus is 89%, almost 90%. So that is really good news for all of us. And it supports the fact that we have good protection even after a single dose. As a scientist and somebody who's worked in the field of vaccines for quite a long time, this is actually incredibly exciting and positive news that we have this very high level of protection in seniors here in BC from this first dose of the vaccine. And we do know that these immediate and positive results are something that we rarely see with vaccine programs. And it is good for as long as several weeks to months. So while it is important to get that second dose, and we will be focusing on doing that, especially in people who are most at risk, we are reassured that delaying that for weeks, even to months, and in the UK and in Quebec, they're looking at 90 days or 3 months for the second dose. We know we have a buffer where we can safely delay the second dose if needed to make sure that our operational issues, that enough vaccine comes to be able to provide those second doses. So that's what we'll be focusing on, and we'll be monitoring very carefully so that we can tell if we start to see a decrease in protection effects. The other thing that we have learned, of course, throughout our pandemic here in BC is that the tide can turn quickly, and that successes that we have had in getting our transmission down and preventing outbreaks can also be washed away quickly. While the overall number of new cases has slowly been coming down and is lower than it was a few weeks ago, it is still very high in terms, much higher than we want it to be. And we are also once again seeing increases in some regions more than others. Particularly, we've seen cases start to stabilize as the outbreaks have been settling down in the interior. We're still having challenging times, of course, in the north in many communities, but on the island as well, things are starting to be managed. But we are very concerned that in some of our higher population areas, particularly in the Fraser Health region and Vancouver Coastal Health region, we're starting to see an uptick. And what we see in terms of cases today reflects what has happened as long as 2 weeks ago. So what we've started to see in the last week is the 7-day rolling average of numbers of cases has started to creep up, particularly in Fraser Health. The percent positive, so the number of cases that we have, of number of people who've been tested and the percent who test positive, and the 7-day rolling average of that also is ticking up, particularly in Fraser Health. And the third thing that we monitor for, that we present in our modeling data, is that reproductive number. And we want it to be consistently below 1, and as far below 1 as we can get it, because that is our buffer. So that means how many people, on average, is a single case transmitting to. And if it's above 1, we know that that means growth can happen very quickly. And in the last week, we started to see this rise above 1 in some regions of the province, particularly in the Fraser Health region. We know that when we start to have transmission from multiple people to multiple people, it grows what we call exponentially. So that means if I pass it on to 2 people, each of them passes it on to 2 people. Very quickly, we get to 4, we get to 16, we get to 256 within 2 generations. So these are the things that we need to pay attention to now. While the numbers seem like they're reasonable, The fact that we're seeing an increase in the reproductive number means that we're not having those safe interactions as much as we need to be. We need to reduce the transmission events that are happening in our community. Once we start to see increases, they rise very quickly, and then we go back to playing catch up again. Because the long incubation period, 2 weeks, what we do today affects what's going to happen next week and the week after. So it's often, once we start to play catch-up, it takes much longer to get the numbers back down. We know it doesn't take much for this spread to get out of control, which is why everything that we do individually makes a difference collectively. If you have symptoms of COVID-19, you must stay home, to stay away from others and arrange to get tested. For employers, if people who work for you are ill, you need to support them to stay home. This is important not just on an individual basis, but means that your business is protected as well. This is not just a Lower Mainland issue, and we've seen this before too, where it starts in the higher population areas, but we know that we still move for various reasons, and it can spread widely around the province very quickly. We have to remember that today's new cases are the result of our actions as long as 2 weeks ago. But what's more important is that what each of us does today is what is going to determine our future. The precautions we take today will define how we fare 2 weeks from now, and what we do makes a difference. We have seen that even small social gatherings can spread exponentially when people go from that small games night that you had together to spreading to schools, spreading to workplaces, spreading to other settings. We need to stay the course with keeping our numbers small, keeping our interactions with others safe. And that means staying away if we're ill, covering our mouth when we cough, keeping our safe distance, wearing our masks, and cleaning our hands. Continuing to follow our public health restrictions and guidance that we have right now is what will lead us into the spring, even as we get our vaccination programs back up and running at full speed once again. So this is a week that's near and dear to my heart. It is what's known as the Random Act of Kindness Week. And I implore all of you to remember this as we get through this phase of our pandemic together, and to remember that kindness is something that is infectious as well. And I remind you all to be kind, to be calm, and to be safe.
Thank you very much, Dr. Henry. I wanted to start by passing on my condolences, those of the Premier, those of the government, those of all people in BC, to the families, friends, and caregivers of the 26 people who passed away this weekend in this 4-day period from COVID-19, 10 from Friday to Saturday, 5 from Saturday to Sunday, 7 from Sunday to Monday, and 4 from Monday to today. This is an extraordinarily difficult time to grieve, and we are thinking of all of you, and you are in our hearts today, and knowing the challenges that this period of pandemic has put everybody in. To have such a thing occur in your family or in your circle of friends is very difficult indeed. Wanted to note in terms of acute care hospitals that we continue to see a fairly stable situation with respect to available beds, about 88.7%. Not about 88.7% of beds are currently occupied in the healthcare system, with approximately 1,090 available regular beds, base beds. 70.4%, if you add our surge beds in, are occupied across the system. That's 3,531 available base and surge beds. In ICU, our occupancy rate is 73.5%, which means 141 beds, base beds are available, and 51.7% when you add the surge critical care beds that have been put in place for 367 available beds. I wanted to note the continued efforts of the influenza vaccine campaign. As you know, there's little evidence at the moment of community circulation of influenza. However, influenza testing continues at elevated levels. That as of February 15th, we know of at least 1,455,412 doses of influenza vaccine have been administered to British Columbians. I just want to note of those, 1,062,970 have been delivered by pharmacists, which is an increase from 724,000 for the same period last year, so an increase of approximately 338,000 doses delivered by pharmacists. Pharmacists have played a central role, more so than ever, in our influenza vaccine campaign this year, and we are very appreciative of that role, and we know that pharmacists are going to play a critical role as we deal with immunizations in the months to come. I wanted to also note, as Dr. Henry said, that 171,755 doses of influenza have been delivered. Just to put that in context in terms of some important sectors, that's amongst long-term care residents, that's 27,483 first doses and 4,057 second doses. In terms of long-term care staff, that's 35,471 first doses and 12,079 second doses. In terms of assisted living staff, that's 9,634 residents, 9,634 doses and 217 second doses. And amongst assisted living staff, 4,830 first doses and 631 second doses. 4,826 essential visitors in long-term care have also received their first doses, as well as 879 people who are effectively in acute care hospitals but waiting for a long-term care bed. That reflected, if you reflect that against our targets when we went through, and as we're in for phase one of our immunization campaign, obviously those sectors have been well covered to date and will continue to be their high priority areas and high vulnerability areas. I want to note and express my appreciation to all of the teams, all of the public health teams, the health authority teams who are working on this immunization campaign. It has real fundamental challenges, not least of which is, of course, some of the interruptions in what was expected over the last few weeks and some inconsistency in when during a week doses arrive, which means sometimes planned immunization clinics have to be canceled. In spite of this, the professionalism of our team, I think our team has been truly extraordinary, and we are appreciative. I want to end by just noting over the weekend I had the occasion to meet with a number of people both in Fraser Health and in Vancouver Coastal Health, where we've seen some increase in the number of cases, especially over the last 10 days, with healthcare professionals in Fraser Health, with young people in Fraser Health, with healthcare workers in Vancouver Coastal Health. This weekend, meeting with them virtually, and I think the message there is clear, that while our immunization campaign is getting back on track to the extent that we're going to receive more doses later this week from Pfizer, that by the end of March, our expectation is, the plan that has been presented to us by the federal government will see about 10% of British Columbians immunized. I know we've said this before, but it's important to note that by April 1st, about 10% of the population will be immunized if the vaccines come in as expected. So until millions of British Columbians are vaccinated, the percentage that must continue to guide our COVID-19 fight in British Columbia is 100%. We have to remain 100% committed to stop the spread. That we stay 100% all in on the effort to use the skills we've been taught, follow the guidance we've been given by Dr. Henry and her team, and obey the public health orders in place to give our vaccines the fighting chance and the greatest chance to build on the work we're doing to keep people safe and save lives. The people delivering our BC immunization plan are counting on us to stay 100% committed to stopping the spread, especially right now, especially when we're making progress, particularly in long-term care, especially when people remain nonetheless vulnerable in British Columbia to COVID-19 and indeed its variants. We have to continue to be 100% all in on the effort. I know that it's been a long time. I know we're now on first anniversaries of events in the COVID-19 pandemic because we saw significant activity right here and everywhere in the month of February last year. But now is the time when all of us have to ensure that we don't let down the people doing the immunization work, but mostly we don't let each other down and allow COVID-19 to relaunch itself in this period, in this important period, as we await everyone having the opportunity to be immunized in BC. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 4 périodes de référence de 24 heures chacune. Il y a eu 26 nouveaux décès liés au COVID-19 durant ces périodes de référence. Nous offrons nos condoléances aux familles et aux amis des 1314 personnes décédées de COVID-19 et à tous ceux qui ont perdu des êtres chers au cours de cette pandémie. Pour la première période de référence, nous avons eu 452 nouveaux cas. Pour la deuxième période de référence, nous avons eu 431 nouveaux cas. Pour la troisième période de référence, nous avons eu 348 nouveaux cas. Au cours des dernières 24 heures, 302 nouveaux cas se sont ajoutés. Parmi l'ensemble des cas confirmés de COVID-19, 231 personnes sont actuellement hospitalisées, dont 74 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone line, please press star 1 to enter the queue. You are limited to one question and one follow-up only. I would also ask that you please take your phones off mute. You are not audible until your name is called. First question is from Justine Hunter, Globe and Mail.
Thank you. Dr. Henry, the Chief Justice of the BC Supreme Court on Friday said that BC was putting the courts in an impossible position in asking for an injunction regarding those church gatherings. I'm wondering, are you planning to amend your orders so that police can arrest people for violations?
So there's a couple of things in that. One, this is before the court, so that I have to be cautious about what I do say. I will say that this injunction was in response to a legal challenge, and until that legal challenge was heard, we wanted to make sure that people understood that the rules were still in place. Anyway, my ability to, under the Public Health Act, to add additional measures to the orders, I don't think, I'm not aware that I have that authority, let's put it that way. And we're not talking about arresting people. What we're talking about in terms of detention was preventing people from entering a premise, for example. And so that is something that is under the Emergency Management Act part of the orders. So these are all things that the legal folk are working out. But I do think it's important. My understanding is that we needed to ensure that people realized that while the court challenge that the churches brought was being heard, that these rules still apply, and they apply for the reasons that we put them in place, based on the science and the evidence, when I believe there is risk of transmission, and where we have seen transmission in these settings, that's where the orders apply.
Do you have a follow-up, Justine?
Thank you. I just want to look back to the issue of booster shots for vaccines. Roughly 150,000 British Columbians have had their primer shot, if I read that correctly. And I'm wondering if you have an idea of how many people will make it in that 42-day window and how many are likely to miss that window. And I heard what you're saying about the 90 days being a possibility, but just in terms of the original target of getting to 42 days.
Yeah, obviously our original target was to try and do it within, 35 days. But, these are operational considerations. And so it depends a little bit on which vaccine people received. So the Pfizer vaccine which we had more of and will have more of, most people are still within the 42 days, at least starting to get second doses at day 42. We have some challenges with Moderna because the amount of Moderna, it was coming in every 3 weeks, and the amount that we're getting next week is lower than expected. So there will be some people, particularly who receive the Moderna vaccine, will be delayed for another week. So it's in the range of 4,000 to 6,000 people for both that will be started at longer than 42 days. But much depends, of course, on how much Moderna comes in later in March, and we don't have that confirmed yet. So it is a very challenging thing. The one thing I am confident of is the increasing data that supports that we have a very strong and robust immune response to the first dose that lasts for the short term. And when we're talking short term, it is definitely in the longer than 6 weeks and at least out to 3 months. So I'm not concerned that we're going to decrease our vaccine effectiveness. I obviously want to protect particularly our most vulnerable people as soon as we possibly can with the best protection we can.
Thank you. Next question is from Richard Zisman, Global News.
And Dr. Henry, considering how many people in long-term care, both staff and residents, have received the vaccine, how is it even possible that outbreaks are still happening and people in long-term care are still getting sick and dying?
Yeah. So the sad thing is that most of the deaths that we've had in long-term care are in outbreaks that started prior to the immunization program starting. And you must remember that we consider a single case of a staff person with potential exposures or a resident as being an outbreak. So we also know that there's a period of time before your body develops enough antibodies to give you protection. And that's about 14 days, somewhere around 14 to 21 days is when your maximum protection starts after receiving the immunization. So what we are seeing right now is the effects that we have not yet passed that critical period of time for everybody who's been immunized. But what we aren't seeing is the rapidly spreading outbreaks that we saw earlier on in November and into December prior to immunization. So, the protection that we're seeing is very robust after people their bodies have that opportunity to develop the response. So that takes a few weeks, and it's still building up, but we're getting there.
Richard, do you have a follow-up? Richard, are you there?
I'm here. Yeah, I'm here.
Go ahead.
The outbreak at the George Derby Center is still happening. It started, as you alluded to, some started before the vaccinations started. But how are we still seeing an outbreak in this facility? How has it gone on so long? And would rapid testing or PCR testing for staff not be advisable at this time to help deal with this ongoing outbreak?
Yeah, so it is the most challenging outbreak that we have, and sadly, the number of people who've died from COVID-19 has been very high in George Derby, and it's been exhausting and challenging for the families, for the caregivers, and for the residents in that facility. And unfortunately, the virus was quite widespread before immunization became available. In terms of testing, obviously in an outbreak, PCR, the more accurate testing is what we do, and it has been done regularly of staff and residents in George Derby, as we do with every outbreak. So there's, when we have an outbreak, when we know that there's a higher probability of people having the virus, whether they're symptomatic or not, we do systematic testing on a repeated basis with the PCR testing with the rapid turnaround time. So that is being done in all of our long-term care outbreaks.
Catherine Garrett, MyPG Now.
Hi, thanks so much for taking my question. The WHO has been given the go-ahead by health officials on the prairies and south of the border in the Pacific Northwest to start their season. When do you anticipate BC to be given the green light, and what's been the delay on that?
I'm sorry, the WHO to start what?
WHO.
Oh, sorry, the WHL, Western Hockey League.
Joe, okay. The Western Hockey League, I have not received an updated proposal from them in the last few weeks. So, we, as I've said before, we're happy to look at that, and I hope that if we continue on the trajectory we are, that we'll be able to salvage a season come March or April.
Follow-up, Catherine?
No, thank you.
Thank you. Next question is from Shannon Patterson, CTV.
from both Dr. Henry and Minister Dix. Washington State has already administered over 1 million vaccine doses, and we're only at 171,000. In the U.S., they expect to make the vaccine available to everyone by April or May, and Canada is saying by September. So can you understand the frustration British Columbians feel when we see our neighbors just over the border in Washington State get vaccinated much sooner with a promise to return to normal by the spring? Do you share that frustration that Canada has not been able to secure as much vaccine as other countries, thereby delaying our recovery?
I don't know if you can read frustration in my face, but of course we do. It is what it is. It doesn't make vaccine come any quicker to be upset or angry or mad about it. We're dealing the hand that we're playing the hand we were dealt, and we are committed to getting immunizations as fast into people's arms to protect people as we receive them, and we've been doing that very effectively so far. We now are very hopeful that once we've started to get supply on a regular basis, and Pfizer has committed to giving us increased doses between now and the end of March, we're also hopefully going to also receive increased doses from Moderna, and we know that there's more vaccine on the horizon. So come April, we understand that the shipments we're receiving from both of those vaccines will be increasing and moved up from where they were initially thought to be received. So from quarter 3 to quarter 2, where we are expecting. I qualify everything because, as we know, with a large global production like this, there's always snags, whether it's the weather, whether it's the production facility, whether it's access to the supplies that we need, the low dead space syringes, for example. So these are all moving parts that are changing rapidly, and we're trying to adapt as best we can. We will be starting our mass vaccination clinics for our elders and seniors starting in March, and for most of us starting in April. So we'll do what we can with as much vaccine as we receive as soon as we get it, and that's what we're planning for and continue to plan for.
I mean, the short answer is, of course, yes. It would be desirable to get more vaccine every day. Every person that gets vaccinated in BC makes everyone else safer in BC. So we'd like to have more, and as you can tell, the vaccine that we have received, we've delivered into people's arms, and the results in long-term care have meant that since January 15th, we've gone from 49 long-term care assisted living, independent living outbreaks to, I believe, 15 today. So that's shows how effective the vaccine can be, and where we have seen and continue to see new outbreaks, they've been among small numbers of people. So we know the vaccine is effective. We'd like to see more of it. Some of the reasons why there isn't domestic capacity to produce vaccines in Canada are well known. There's a debate about that from our past decisions that were made about this have affected us now. There's no question about that. But as Dr. Henry has said, we have to deal with the situation in front of us, and simply complaining about it is not sufficient. Although, let's be clear, we have to make sure, I think, as a country, and Canada at the national level has to make sure that that this situation is dealt with in the future. But for right now, we have to take the vaccine we can and deliver it in the most effective possible way to protect the most vulnerable first, and then everybody else. Would we like to have more doses? Absolutely. Every single day we think we'd like to have more doses, every week and every month. But we are dealing with those that we have, and I think the folks doing the campaign on the ground who are delivering, especially have delivered immunization in healthcare facilities, are doing an extraordinary job, and we have to recognize their work.
Follow-up, Shannon?
Yeah, for Dr. Henry, the National Advisory Committee on Immunizations is recommending that racialized Canadians disproportionately affected by COVID-19 and essential workers who can't work virtually be put in priority 2 for vaccines. Is BC considering changing its plan to accommodate this?
No, yes and no. These are important considerations, and we've had ongoing discussions with NACI and with my colleagues across the country. And I think what they're trying to reflect, which we absolutely agree with, is that some populations are differentially affected by COVID and by the measures that we've put in place to deal with it. And many of them come from racialized communities where access to health services is less than others, where workplaces may be less able to support people, so lower wage places where you may not have a sick leave, for example, and we know that that's an impact on communities around BC as well. So what we are focusing on is making sure that we can monitor who's being immunized and address those populations who are not equally accessing vaccine at the same time. So if we look at our priority population are people in the community over age 80, and we will be monitoring to see if we're getting people from all communities over age 80 to receive vaccine, and doing special targeted programs if we are finding that some communities are falling off or are not accessing vaccines because of the way our system is set up. So that is something we're very mindful of, and we will be considering. I will also say that, when we look at some of the populations we're talking about, some of the people we're talking about, many of them work in our healthcare system, our care aides and the staff who work in long-term care homes. Many of them belong to racialized communities who are differentially affected. So making sure that we meet their needs, answer their questions, make sure that people are comfortable and understand the implications of receiving vaccine, and do it in a way that's safe for them is a top priority for us. So I don't think they're mutually exclusive. They're not a separate group. What we're trying to do is ensure with every priority population that receives immunization that we're doing it in a way that increases equity. It's challenging, of course, but we'll be continuing to monitor that carefully. The one other thing I will say is, we have other vaccines that are on the horizon. AstraZeneca is in for review, as is Novavax and Johnson & Johnson vaccines. And these are all ones that are much easier to use in that they're fridge stable. So we can target people who aren't able to work from home, people who are essential workers, whether it's police or fire services or education workers, or people who work in our grocery stores and other places. So we are very conscious of that as well, and are looking at how we can target populations to bring everybody's immunization up as we receive vaccine. But of course, none of those are approved for use yet in Canada.
Next question is from Marcella Bernardo, News 1130.
Thank you, everyone. Dr. Henry, I was hoping to ask you that you touched on this a bit today, but with dozens more school exposures reported in recent days, how concerned are you that public safety orders are not being followed by families that are still allowing sleepovers in their homes or teenagers hosting Super Bowl parties, further increasing the risk of this virus spreading inside a school environment?
Yeah, and these are the things that we are concerned about. Particularly, we know in the Fraser Health region, in Vancouver Coastal, the Lower Mainland, but also other places, that we are seeing exposures that are happening. About 40% of them, from what we're seeing, are from social gatherings. Social gatherings that should not be happening right now. This is what the message we're trying to put out there. It has implications. Even though you think that you're not at risk or your family's not at risk, we know that that these types of events, we know of a games night where there was 50 people in an establishment that should not have been having a games night, and that 15 people from that event, which is against orders, became infected and spread to several workplaces, to schools, and to a childcare center. So these things are what we all need to hold each other to account. We in public health cannot be in everywhere. We can't be in every pub or restaurant or business or every place all at the same time. We need to hold each other accountable right now for stopping the spread, because that's what's going to get us into the spring where we have enough vaccine to protect people. And what we're seeing in schools right now reflects the transmission that we're seeing in our families and our communities.
Follow up, Marcella?
I'm kind of sorry that I have to ask this next question, but it is about an owner of a local comedy club that says British Columbians could use a laugh more than ever right now, and if restaurants and bars are allowed to operate, so should comedy clubs. So if venues like comedy clubs and theaters updated their COVID safety plans, how soon do you think you could consider letting them reopen?
You know, there's things that are the short answer is right now we're still seeing too much transmission, and no, I absolutely agree. We could all use a laugh. We can all use some joy in our life every day, but it doesn't mean we have to go to a comedy club. And we have seen where people think they're doing okay and it's just a little bit of a stretch and we're not really breaking the rules too much, that we see spread of this virus, and it gets into our communities and it gets transmitted in workplaces, it gets transmitted in schools. We see people ending up in hospital and we see the effects of that. So now is not the time to be increasing our social interactions and social gatherings, and it's not the time for those types of events.
April Lawrence, Check News.
Oh, hi, thank you so much. Dr. Henry, with two outbreaks at Nanaimo long-term care homes, families there are pushing to know whether all staff members in the facilities that are working closely with patients, whether they've been vaccinated. And I realize there's issues around privacy, but they say that they have a right to know. And if they haven't all been vaccinated, can you tell us why?
Yeah, so we'll be presenting some data on that on Friday. We have collected that staff immunization rates by facility, so you'll know. Nobody has a right to know an individual's immunization status, and that's something that's important for all of us in terms of our own protection. And I will say, with these vaccines that we have, it is also important to know that direct protection of seniors and elders with vaccination themselves is very effective. So unlike influenza, for example, where vaccinating in a ring around people is so important because we don't mount as good an immune response as we get older, that is not the case with these new vaccines, which is really why I'm so excited about them. They work well in older people themselves. That's, miraculous in many ways. So while it is still important, and we will be targeting, there's very few, but there are a few care homes where not everybody, not all the staff are immunized, and what we need to do is make sure we understand why, and we give more opportunities for people to receive the vaccine and receive the information they need to be comfortable receiving the vaccine. That's so important, especially with these new vaccines. So that is something that we'll be following up on, but still, we know that one or two cases can happen even when everybody's been immunized.
Follow-up, April?
Yeah, thank you. And I know you've been talking about the shortage of vaccine, but I was wondering if you could tell me when second doses might be rolled out in these two particular facilities, and whether you're giving any priority for those second doses to long-term care homes that are experiencing an outbreak.
Yeah, so we did initial immunizations in care homes that were experiencing outbreaks as a way of protecting the second generation as best we could, not always successfully depending on the timing. But yes, the residents in particular of care homes are people that we want to get the second dose in this timely way as we can. Some of the care homes that were done later are not yet at the minimum period, so that's something to consider as well. But we are looking at it's less important for younger people, more important for us to protect older people as quickly as we can.
And just, April, it's already started. I think I reported earlier, but just important to note, about 63,000 long-term care residents and staff have been immunized. About 16,000 have already received their second dose, so that process is on the way. 4,826 essential visitors as well, and many people were sometimes referred to as ALC patients in acute care hospitals have also been immunized. So we're well on the way there, and in many care homes well on the way for a second dose. And so the detailed information per care home for residents will be provided on Thursday, I believe, or Thursday and Friday, and we'll put that information out for everyone to see. But I think it's pretty uniformly high across health authorities and pretty uniformly high both amongst residents and staff. And the sheer numbers, our total target in BC for long-term care staff was initially 37,000, is now 39,000, and obviously there's approximately 30,000 residents in long-term care, so you can see the extent of the immunization across the province.
We have time for one more question. For everyone listening, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated province-wide restrictions, visit gov.bc.ca/COVID restrictions. And for information about the province's orders and pandemic supports, visit gov.bc.ca/COVID-19. Last question is from Zara Premji, CBC. Are you there, Zara? Okay, we will move on to Dominique Levesque, CBC Radio Canada. Dominique, are you there? Okay, one more try. Camille Baines, Canadian Press.
Henry, regarding the viruses of concern, what percentage of COVID positive samples are being sequenced right now, and do we have capacity to scale that up if necessary?
Yes. The short answer is yes. In terms of scaling it up, what we've developed, or what the lab has developed, is a marker, a SNP marker. So it's one of the ones that you can do all of the positive tests. You include it with the as part of the PCR testing, and we did what we call a point prevalence over 5 days. So they did 3,099 positive samples that were collected between January. So all of the samples that were positive between January 30th and February 5th. And of those, we found only 3 were confirmed to be variants of concern with whole genome sequencing. So that process continues. I don't actually know the percent we're doing on a daily basis, but I know we're doing the marker and trying to get up to doing as many of, if not all of the positives, with at least the screening test, and then doing samples of the whole genome sequencing. Overall, we've done about 10% of the genomes that we've isolated in BC with whole genome sequencing.
Camille, do you have a follow-up?
Yes, I do. Thank you. What's known, and I know it's early, but so far what's known about the variant first identified in Nigeria, and what's your concern about it, considering, since you mentioned one of our cases, or the only one last Friday, there have been more cases of it in the UK and elsewhere, so what's your concern about it?
Yeah, so one of the things that the lab folk look at is there something about the mutation that gives that strain of the virus or that variant increased ability to transmit, cause more severe disease, or be more virulent, or interfere with the ability of tests to pick it up or the vaccine to work. So those are things that now have been associated with a couple of different known mutations. One of the ones that seems to be the most concerning is about transmission, and increased transmissibility has been linked with a variant that's called 501Y. So this one that we picked up 535 does not have the 501Y mutation, but it has a couple of others that are, and I don't have it in front of me written down, but there's a couple of other variant mutations that are also seen in things like the variant we saw from the UK, the 117, that may be linked with increased transmissibility. So we've seen lots of different slight mutations in the viruses that we found here in BC and across the country, but not all of them give the virus any advantage that makes it more likely to sort of take over. But there's some that are, and one of the mutations that this variant that was originally associated with Nigeria has is one that is of concern. So that's why our lab folk have decided to include it in the ones that we monitor for.
That's all the time we have for questions. Thank you.
Thank you.
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.